It's important to lead by example. I'm going to say that right off the bat. It's important to lead by example, right? This is not any do what I say and not what I do situation. These are grown adults. They're looking at you, and it is important to lead by example. So, 5 things I would say to do to lead by example, right? It's important to perform, right? You want your team to perform. It's important to perform. You know what's annoying is when you see someone that has such high demand of their team members, but the way they present is as if they themselves really are not doing anything. It is so good to see a team member who it is clear that they're not asking you to do any anything that they wouldn't roll up their sleeves and do themselves. This is Dr. Judy Wright, physician and wellness and performance strategist. Today, I want to talk about effective leadership and how important that is. Whether you are a leader in the healthcare space or you are looking in the future to be a leader in the healthcare space, it is super important in healthcare to have effective leadership. This doesn't just affect the medical professionals working within the healthcare space. It also affects colleagues, other leaders, and ultimately it can affect the population that you are trying to take care of or the population that is under your lead. So let's get into it. Okay. So, why is effective leadership such a big deal? So here's the thing. As we are seeing more shortages of doctors and nurses and other healthcare professionals, healthcare workers leaving the space, here's one thing that we'll talk about more a little later, but here's one thing that I heard years ago and it's always stuck with me. And that is, people often don't leave jobs, they leave managers. People don't often leave jobs, they leave managers. Effective leadership, right, allows people to feel safe. They allow people to feel empowered. They allow people to feel satisfied in their jobs, more energized, more creative, right? And more productive overall. And when you do not have effective leadership to help guide you through that, worse yet, and I'm not talking about not having any leaders, I'm talking about not having effective leadership and, in some cases, toxic leadership. Let's just be honest and real with it. Let's just be honest and real with it. Okay. I know that everybody out here that has held a job or has held more than one job, if you're the lucky person that maybe has had one job and an excellent leader, wonderful. But if you've held more than one job, somewhere along the line, whether it was your direct leader, an indirect leader, you have encountered an ineffective leader, right? And you can be an ineffective leader whether you are causing a toxic environment or whether you are doing little or nothing to actually lead. You're kind of just there holding the title and holding the space, but you're not really doing anything, right? And as somebody who has been the team member and someone who has been the leader, I can tell you that it takes work to be a good, effective leader on the leadership side. But I can also tell you that an ineffective leader, regardless of if sometimes they make it about just the employees, an ineffective leader could be the cause of why the main goals are not getting met. Right? So I talk a lot about how medical professionals can manage themselves, right? Because this is the part that medical professionals can control. We can't control what the leader does. However, if you are a leader, this is your time to listen and your time to shine. And if you are planning on being a leader, this is your time to listen and your time to shine maybe later with that. But this is your time. Learn it now. Okay? As an aside, I also want to say this: we all have the ability to lead, all of us. You don't actually have to have the title of manager or supervisor or even the C suite to be a leader. You can be a leader among your colleagues, right? You could be a leader in a particular thing among, maybe you're the tech lead, right? Maybe, and then somebody else is, good at executive management lead. They may not actually be, the person who on paper is called that, but maybe they're good at organization and they can help the team with that, project management, and they can help the team with that. Somebody may be good with understanding reports and they can lead with that. We all have the ability to lead. When I say leadership, yes, we're mostly talking about the people who have been given that title, but everybody has the ability to be a leader. And because you have the ability to be a leader, it is imperative that you hone in on those skills that you have, especially if in the future this is part of your trajectory, this is part of the success, the movement to success levels that you want, and why you want to be performing at a sustainably high level to get to that goal. Before we go on, if you're new here, welcome. If you're not new here, welcome back. Okay. And if you have not done so already, subscribe, like, and if you are able, comment. If you're just listening on the podcast and you would like to visualize, you can always look on YouTube, and there you can subscribe, like, comment, share, hit the notification bell. All right, so you can know when we release another show. Okay, so let's talk about the impact of leadership when we're talking about team performance, right? Super important. There was a study that came out last year, 2023, that showed. Remember what I said, people often don't just leave the job, they're leaving the managers. In the study, it showed that over 50% of the people said that their work manager had a greater impact, whether it be on the positive side or the negative side, a greater impact on their mental health than even their therapist did, than other people in their lives did. So if that manager was a stress bucket, right? If that manager was a micromanager, if that manager was the kind of manager that, they didn't feel as if the manager felt they were doing a good job, that could negatively impact their psyche. And even if they had a therapist, there's not much the therapist could do about it, right? So, according to a Gallup study, managers account for 70% of the variance in employee engagement scores. So, if your manager is the type that encourages that level of engagement between you and them and you and the rest of the people in the team, right? Great. If your manager doesn't, not so great. But the managers account for the greater part of the variability that you see in those engagement scores. Research by the American College of Healthcare Executive found that 93% of healthcare employees say that their trust in their leader is essential for them to be satisfied at work. If it's one thing that I always say, right? A lot of people think, well, I'm not doing stuff for without getting more money, right? And if you're doing a lot of stuff, hey, you do deserve money. But let me tell you how many people will happily do a little bit more, not even thinking about more money because of, they're satisfied at work and they're satisfied with their job and they feel loyalty to their leader, their manager, because their manager shows them loyalty back. It goes such a far way, right? And I think I wish more people realize that, right? So let's talk about psychological safety because this is really important. So, what is psychological safety? Psychological safety is the belief that one can speak up without the risk of punishment, retaliation, humiliation, right? So, this is super important in healthcare. This is super important in any organization, in all types of industries. It's really important. But let's talk from the healthcare side. When someone feels that they can speak up and not be ridiculed, and not feel devalued, and not feel as if they're going to be punished or retaliated against, they are more likely to report when something is not going well or doing well. They're more likely to report errors. This is very important when we're talking about even not only just being honest, but also the safety of that person, the safety of their colleagues, the safety of their patients, right? Ever reporting, if you feel like you're going to get retaliated against, you're less likely to do it unless you feel like someone is encouraging you. This is like when, I was just talking to somebody about this the other day, right? You know, as parents, you could be, and that's your prerogative, the parent that is like, boom, no drinking ever. Um, this is not negotiable. This is this. This is that. Okay, we're only going to talk abstinence, because anything else would seem like I would be like me condoning it. There's nothing wrong if that's how you decide to parent. That's how you decide to parent, and there's factors that go into that. But if you decide you want to parent another way, meaning, look, I want you to know I don't agree with you drinking before the age of 21. I don't believe in being sexually active at a young age. I don't condone that. I really don't want you to do that. However, that said, if you find yourself in a situation, maybe you went to a party, you find yourself in a situation where maybe you did drink. I don't want you to do that. But I do know that there are times when things get spiked or whatever. I would rather, or you're at a party and your friend who was the driver drank. I would rather you call me and ask me to pick you up no matter what the time, no question asked. I need you to call me to pick you up because I would rather you be safe. I don't want you driving. I don't want you getting in the car with people who were drinking, right? So that's you not condoning the underage drinking, but understanding that S happens, right? Similarly, if if someone sees that every time an error gets reported by one of their colleagues, that colleague kind of gets beat up, battered, whatever, they're less likely, you know, to report an error. So this is not what you want. Also the other thing is that when you have psychological safety, you're more likely to not just come up with new ideas, but share them. Share innovation, share ideas for problem solving. I love when I hear people say, right, that every suggestion is on the table. I love that. And if you follow through with that as a leader and not just say the words every suggestion is on the table, then when they put the suggestion on the table, you're like, right? It's important that if you're going to say it, you mean it, right? But imagine people feel safe enough that, I can ask a question and people are not going to think it's stupid. I can put out a suggestion and people are not going to look at me like I'm crazy. Okay? So, even that, the ability to talk about something that happens already or give your ideas on why you think a particular thing may lead to an issue without being called or made to feel negative. Oh, you're being negative. We just need positive people on the team. When all that person may be trying to say is, okay, thinking this through, why don't we be proactive on thinking what could happen? Or we've already done this, and this is what happened, why it didn't work the first time. I'm just letting you know that. But maybe if we think about ways to tweak that, we can get it to work better, to iterate another, version of it. We could get it to work better rather than knowing that they're going to be seen as the negative Nelly. They're less likely, they don't feel safe, they're less likely to give their opinion, right? And having psychological safety increases job satisfaction and reduces burnout. Burnt out team members are not productive team members. Unsatisfied team members are not they're not productive team members, right? So you want them to feel safe enough to be able to feel creative and innovative and to be able to be productive and not stressed out, right? And to be able to be honest. You want that. And if you're honest with them, you are more apt to get honesty from them. A study in the Journal of Patient Safety found that on medical units, nursing units, medical units, that had more high psychological safety, they had a 26% lower patient mortality rate. That is significant. That is significant. Very significant. So let's talk about what an effective leader looks like. What does an effective leader look like? So let's talk about those traits. All right, traits of the effective leader. Emotional intelligence. Dun dun dun. What is emotional intelligence, right? Some of you may have heard it, but do you know what it is? And emotional intelligence, they talk about emotional intelligence, which is EI. They talk about the emotional quotient, EQ, right? Emotional intelligence is the ability to recognize, understand, and manage our own emotions, right? And which is what I often talk about. What can we control? What can we control? Because we have to work on that first. What can we control of ourselves? To manage, understand, become self-aware, and manage our own emotions, right? Which will help us manage our stress, which will help us perform at a higher, more sustainable level with less stress, less sacrifice, and higher levels of success. This is what I always talk about. But also, as the effective leader, because you have become more self aware, you have become more aware. So you also work to understand, recognize, and influence the emotions of others, right? So you become more aware of those who work for and under you. You're able to show more empathy. You're able to actively listen. You're able to when they're not willing to reach out, maybe reach out to them and say, I noticed that there's a bit of a change. Is everything okay? Is there anything I can do to help? Okay. Do you need some resources? Recognizing when something like burnout is impending because you actually understand and know your team member, right? And everybody's going to be different. And this is part of your emotional intelligence because you understand that everybody is different and they all may need to be handled differently. Gone are the times where it's just like treat everybody the same. We already know that students don't even learn. They don't even all learn the same. You have to have a variety of modalities to teach students so that they all can be successful, or else no student left behind can't work, right? You can't say that. So how do you not, work to not leave a team member behind? And emotional intelligence is part of that. Okay. Another trait of an effective health leader is clear communication skills, right? This is something that is so important to me. Whether you are speaking, typing, um, or writing, clear communication skills is a must to be an effective leader. If you are the type of leader that think people are supposed to read your mind, you have already lost. You have already lost. Okay? I have known a couple of people who thought that whoever was their executive assistant or the such should be able to read their mind. They should be able to say two, three words of a sentence, and from that assistant should have a whole protocol. That's not how that works, right? You are setting that person up for failure, and if you are dependent on that person, you're setting yourself up for failure. You're setting your team up for failure, right? So it's extremely important to have clear communication skills, right? To increase the chances of getting the work not only done, but done correctly. Not only done, but done correctly. But also, when you clearly communicate with them, you are encouraging them also to clearly communicate with you so that if something you said may not be clear to them, they can say, I don't think I quite understood that. As opposed to, okay, I don't feel like I can ask any questions about it. So clear communication skills are key. Number 3, vision and strategic thinking. Being able to think through a process and communicate that process and the vision. When you can communicate that process and the vision properly, it helps you get buy-in from your team members. And that's the thing. You should want buy-in from your team members, right? It shouldn't just be crack the whip. This is what we're going to do, and that's that. You should have vision, right? Be able to think through it strategically and communicate it strategically, and be open to listening as you're communicating it strategically, right? But when you're a leader and you're able to do that, that garners more respect, right? Then it just seems like random throwing the spaghetti to the wall to see what sticks, right? 4, be adaptable. Be willing to. We're seeing that in workplaces now, right? A lot of employers are trying to think this through. Be adaptable, right? And that may mean, again, different people have different skills. You may need two people to do this particular thing, but one of those two, that's not their forte. But the person you hired for this thing over there, it may be their forte. Be adaptable. Be adaptable with schedules, right? These are people. These are people. And people have different skills, they have different responsibilities. These are people. Are they supposed to work? Absolutely, they're supposed to work. But be adaptable. That adaptability is very important. That adaptability, you never know what happens where somebody suddenly can't work. Maybe they have to call out ill. That adaptability, when you're adaptable, it helps you to teach the team how to be adaptable, right? Number five, commitment to continuous learning. I can't say this enough. Not only should the leader be committed to learning continuously, the leader should be committed to providing opportunities for the team to learn continuously. Everybody should be engaged in lifelong learning. Nothing is static, things are dynamic. As you grow, you need to learn more. And I truly believe every day is, I don't care what I learn. It could be the silliest thing, right? Where I'm just like, ooh, I was today years old when I learned it. It could be something about foil paper, right? Or it could be something that has to do with medicine. I believe every day is an opportunity to learn. And I truly believe that if not every day, virtually every day, I learn something new, right? So a commitment to continuous learning is a commitment to continuous growth and sustainable high performance and success. Have that growth mindset, but you need to be continuously learning to do that. And finally, last but not least, the effective leader has empathy and compassion. That doesn't necessarily mean that you're going to end up sniffling and crying with somebody if they're having a hard time. But you may not be going through that thing, but you can have the empathy and the compassion to understand enough that this thing may be bothering this person. So, empathy and compassion. Those six things, okay, I'm going to go over it again: emotional intelligence, clear communication skills, vision and strategic thinking, adaptability, commitment and continuous learning, and empathy and compassion. Those six things are the characteristics of an effective leader. But some of the common pitfalls that you could make, right? Some of the common pitfalls of an ineffective leader: micromanagement. Let me tell you something. People do like to get um, organized ideas, organized thoughts of what to do, right? You might even have a list. Do it like this, and this. But people also like to have some autonomy. Give me my list and let me do it. If you micromanage every little thing, you're showing me you don't trust me, and I don't understand why I need to trust you. And if I feel untrusted, if I feel like you think I'm inadequate, if I feel like you feel as if I don't know how to do the job, I'm not going to be happy about doing the job. And I'm going to feel like, why did you even give it to me? Why didn't you just do it yourself? Right? Lack of transparency. So this goes with communication skills. If you're not going to be transparent, then the question becomes, I don't know what to do. You're setting me up to fail, right? Why does the job have to be like this? Also, if there's an issue, lack of transparency around there being an issue, you telling me everything is great when it really is not. We see this happening with people who are getting downsized. Everything seemed great a week ago, and now all of a sudden we're getting downsized. You think these people believe that everything was really great a week ago? No, these people believe and are offering right that things were going wrong a week ago, but you weren't transparent that that was what was happening, and you're not being transparent now about what's happening as I'm being let go, right? Inconsistency in decision making, right? When you are inconsistent in decision making as a leader, this is ineffective. It can look like you don't know what you're doing, but it can also look like bias. Either way, this is not what you want. Failure to address conflicts. If you see a conflict happening, right? I understand. Trust me when I say I understand. You feel as the leader, these are grown people. They should be able to manage their own conflict. And in fact, I know for a while, for some years, that definitely, it may still be happening. I don't think as much, but that definitely was one of those top questions that they would ask on the interview. How do you manage conflict? Let's say so and so and so. How would you manage that conflict? Right? So they're expecting you to be able to manage your own conflict, right? And if you can't, they expect you to go up the chain of command. However, as the leader, if you see this conflict happening, if you see this conflict happening as the leader and you do nothing, you are being ineffective, especially if it's not only affecting each of those team members, or, but also the team as a whole and the team productivity. You are being ineffective. So that's another common pitfall. And the last common pitfall is neglecting the development of your team, professional and personal. Right? When you neglect the development, the learning the opportunity to present learning for them, you know, it makes you an ineffective leader. If you're neglecting team development, right, your team is not keeping up with the growth that is often expected in whatever industry you work, but also in healthcare. Information is ever changing, ever changing. So if you're neglecting team development, team learning, neglecting learning for the team, especially when they may be working long hours, they're exhausted. So to be able to find it, take the time out to read on their own when you could be, you know, presenting them with opportunities during the workday, you know, that's not an effective leader, right? Okay, so it's important to lead by example. I'm going to say that right off the bat. It's important to lead by example, right? This is not any do what I say and not what I do situation. These are grown adults. They're looking at you, and it is important to lead by example. So, 5 things I would say to do to lead by example, right? It's important to perform, right? You want your team to perform. It's important to perform. You know what's annoying is when you see someone that has such high demand of their team members, but the way they present is as if they themselves really are not doing anything. It is so good to see a team member who it is clear that they're not asking you to do any anything that they wouldn't roll up their sleeves and do themselves, and you watch them do it, right? They're going to stay late with you to get something done as much as they can do so. They're going to, if one of you are have to call out, they're going to jump in and help. You know, a supervisor that jumps in and helps rather than just, okay, you're just going to be short because that's just the way it is. You guys just have to, every time, right? But when you see that supervisor, that manager jump in and say, "Yeah, I'm going to be the acting nurse with you guys today," right? Like, so when you see something like that, you're like, okay, okay, right? Because they're high performing. But also when you see the way that that leader, when that lead you as a leader, let's say you as a leader, you're coming up with ideas, and you're encouraging them to come up with ideas, right? And when things happen, you're not just taking all the credit. You're saying, my team should be lauded because they also were performing at that level. But it started with you. So high performing leaders are better equipped to mentor and help develop other team members to show their leadership qualities and later become named leaders, right? Can we talk about stress and leaders who are stressed out for a bit? This is the real trickle down economics right here. um, when a leader is stressed out constantly, consistently, um, and that stress is either leading to anxiety, depression, angst, you know, it shows. It shows. A stressed out leader leads to stressed out team members. At first they may be like, yeah, no, but eventually that constant stressed outness, that constant stress in the environment, in the ethos, starts to wear down on everybody. And it could either make them very annoyed or stressed out themselves, right? When I say this is the real trickle down economics, this is what trickles down, and those people, if they get stressed, they get annoyed, they have less patient satisfaction. Get ready, money's about to be lost. Money's about to be lost. So it's very important for leaders to practice stress management, mindfulness, exercise, time management, right? Setting boundaries. And if the leader's going to set boundaries for themselves, they need to encourage the members to also set boundaries, and they also need to be willing to respect those boundaries. But stress management for leaders, and when you're a leader who's managing your stress, say that out loud. Look, I get stressed out sometimes too, and this is what I do about it. Because now you're teaching them, just because I'm a leader doesn't mean that I'm not human, and I understand that you're human too. Right? So, again, it trickles down. There is a study in the Journal of Applied Psychology that found that leader stress can increase employee stress by 40%. That's huge. I don't even need to say any more about that. It's important for leaders to manage their stress. Also, balance self care with team care. Implementation of team wide wellness initiatives is a must to lead by example. When you're like, self care is important to me, you guys engaging in self care is important to you. If you don't know how to go about doing this, we're going to have some wellness initiatives, because self care is health care, self care is team care. I'm making sure that you are taking care of yourself too. And on top of everything, I want your life, I encourage you to live as balanced a life as possible, whatever that looks like for you. And you can do that through example, but also put policies in place. And if you think that policies can't be in place, the funny thing, in this country, there are people who only have 1 week of vacation a year, 2 weeks of vacation a year, 4 weeks of vacation a year. The average vacation time in Europe is 6 weeks, and in some countries it is law that job must give you your 6 weeks, that you must take the 6 weeks. They don't care what you do with it, but you need to take it. So understand that even by policy, you can help and encourage people to balance and engage in self-care to get them there. Also, creating a culture of respect is so important. It's so important for leading by example. Show respect to your colleagues, show respect to your team members, show your team members how to show respect to each other. This is not about the necessity of developing friendships at work because that is not necessary. But there needs to be a culture of respect, because just as you are trying to develop a culture where people feel psychologically safe, you cannot allow for disrespectful behavior to be within the culture, right? So you have to acknowledge and value the diverse people and personalities and perspectives that are going to be in the healthcare space, and you also must have zero tolerance for disrespectful behavior. Again, if you can't do that, you're an ineffective leader, right? So, here's 5 key actions to be an effective leader. Action 1: cultivate emotional intelligence. We already spoke about it's the ability to recognize and understand and manage your own emotions while you are recognizing and understanding and influencing the emotions of others. That is cultivating emotional intelligence, and you can do that by practicing self-awareness, practicing awareness of others, empathy, and active listening, and having, you know, various outlets and resources for those team members. Action number 2 is establish those clear communication channels. If 2020 and 2021 taught us anything, you don't need to be in the same room to communicate, right? But your communication needs to be clear and it needs to be respectful. I have encountered way too many people that do not know how to properly communicate and with respect in an email. That the fact that somebody cannot be in your face and hear your inflections, how you come across in an email looks different than how you come across when you're face to face with somebody. So you need to be very careful. You need to be very careful. And if you're not sure, I always tell people, write it. Don't even put anything in the who it goes to yet. Write it, leave it in draft, come back a couple of hours later, read it, and decide, is this the way I want to say this? Is there something I need to change? Or, all right, you know what? I'm over it. Maybe I'm not going to send it at all. Right? Like, this is so important. But establish clear communication channels, and you can use multiple ways. It could be in person, it could be by email, it could be by phone, it could be by digital platforms such as WebEx or Microsoft Teams or Skype, Zoom, whatever it is, right? Make sure that you are communicating um, regularly. If you truly have an open, if you know you don't have an open door policy, don't say you have an open door policy, because that really means that people can come to you at any time. And it's okay that maybe people can't come to you at any time. However, you need to make sure that you have regular opportunities to engage and communicate. That could be regular team meetings, like weekly or bi-weekly team meetings, even monthly team meetings. That could be regular one-on-ones, right? But you need to have regular channels to be able to communicate. Action number 3: foster a culture of continuous improvement. So that means you're willing to give regular feedback, and not just feedback when you feel they didn't do something right. Feedback when you feel they did something very right, right? Because that oh my goodness, the way that just that little piece, how big that is. That feeling of you did good. That was a win. You should take that as a win. I'm very thankful that you're on the team. Oh my goodness, you have the payback from that is ridiculous. It's ridiculous. Um, but also encourage feedback, encourage ideas, and make sure you're doing your performance reviews and helping with development plans or encouraging them to do development plans. Action number 4 is inclusive decision making. One of the big things for people, for workers, healthcare, medical professionals included. I mean, these are people who have licenses and certifications and oh my goodness, right? Like they did do work. They want to be included and they want to feel autonomy and they want to be included in the decision making. So ultimately the big bosses are going to make the decision, but what does it mean to be included in decision making? You came and you say, this is the direction we're thinking of going, but let's tell you all about it and get your opinions on it. Because sometimes if you are in the business segment, right? You don't really know what goes on in the day to day of the clinical segment. And even if you are the head of the clinical segment, there's so much administrative stuff that you're doing. You may not know the implications of the day to day, right? So it's really important to include people in decision making before you make the ultimate decision. And again, that leads to a feeling of respect, a feeling of being valued, and job satisfaction, which is going to increase productivity and performance. And finally, action number 5 is prioritize personal and team well-being. You're going to lead by example in taking care of yourself, taking care of your physical, mental, and emotional health, making sure that boundaries are being set and respected, making sure you're managing stress and you're keeping a balanced life. These and even encouraging them to pursue their passions and understanding what their goals are for themselves within this workspace, right? All of those things go to fostering and bolstering the team effort and the team structure and also the team environment, right? And team satisfaction. Super important. So, the main takeaway here, okay, is that effective leadership in healthcare is all about creating a positive and empowering shadow. You're going to create a shadow as a leader anyway. Make it a positive and empowering one that encourages everybody to get the most out of what it is you're doing, to be happy with what they're doing, but not to put this above everything else in their life like nothing else exists. To make sure that they're feeling balanced, that they're managing their stress so that they can perform high level, make sure that the patients are being taken care of, make sure that they're working well with their colleagues. And overall, this is a benefit to the individual, the team, the healthcare environment at large. I encourage you to start focusing on one thing, one area of improvement. Perhaps you're already doing something, but if there's something else you can be adding to that, whether it is you're working on emotional intelligence or implementing a more routine method of communication, start. Just implement something, right? To be an effective leader, or for those of you who are looking to be effective leaders in the future, start something, because what you're doing today will tell for tomorrow and beyond. Okay, again, this is Dr. Judy Wright. I'm a physician and a wellness and performance strategist. If you are still here, thank you so very much. Subscribe, like, comment, share, hit that notification bell, and I look forward to talking to you again soon. Bye.